I'm sorry to tell you this, but it's time to take the bird flu seriously. Bird flu is basically a cute term for avian influenza. It's a kind of influenza that preferentially infects birds. But that's starting to change. This virus is now everywhere in the United States. We have about 67 infections that the CDC knows of so far. And what's really striking about that is that in June, there were only 3. So all of a sudden, there's been a real uptick. And that's how we know that something about the virus is changing. In January 2022, we saw that it was also in wild birds in the United States, that it very quickly went on to infect lots of different bird species. And now it has infected dozens of animal species, cats, raccoons, bears, sea mammals, and cows, which we never even knew were susceptible to this kind of flu. And now we had all of these herds all over the country that were infected with this virus. And what was also really strange was that there was a lot of virus in the milk of these cows. One of the big things that's raised the alarm is the first death of an American from bird flu. There was a person in Louisiana who had been interacting with sick and dying birds. This person was over 65 and had underlying health conditions, so that tells you that maybe they were extra susceptible. The reason that this is an alarming case, apart from the death, is that the virus changed while in this person into developing some mutations that make it easier for it to infect people. Flu viruses are very good at changing and picking up new mutations, and with each infection, the virus has a new chance to mutate. If it comes across the right combination of mutations that would allow it to infect people more easily instead of birds, it could start jumping from person to person. So that's the big worry. One scientist I talked to put it this way: it's a bit like playing roulette. At some point, the virus is going to hit the right numbers to make human-to-human transmission possible. That's when we start thinking that it might lead to a pandemic. There's no need to panic quite yet. It's not a pandemic and may not be ever. But it is very important that we take all the precautions to stop us from getting there. We know that we should wear masks if we encounter a respiratory virus. We should stay home if we're sick. We should get vaccinated if a vaccine is available. And that includes being very careful to not interact with infected birds. Don't drink raw milk, don't eat raw food, don't feed it to your pets. We learned a lot of lessons during the COVID-19 pandemic that could help us in this situation, but it's unclear, just given the pandemic fatigue that everyone is under, how many people will be willing to follow all those precautions.